metastasis in the lymphatic nodes around portal vein. The patient has got a problem. The hypertension of the portal vein. Blood should take through liver, but it's impossible. So the blood tries to find the alternative pathway for passing. And opposite direction of the passing of the blood. Blood goes from the portal vein from liver, passes through left gastric vein, passes through esophageal vein, passes through smallest veins, and go to the azic and hemiazygous vein.
Oh,
Except liver.
reverse passing.
Да, reverse, да. But no, esophageal vein, it's very, very thin. A lot of time, blood pass, and we have dilatation. Pathology condition. I will show now. 1 second, just. Dilation. Varicose dilatation of the veins of the esophagus. Так. Сейчас, Russian.
Varicose.
Да, varicose dilatation. Look at the inside lumen of the esophagus. You can see the dilatation, and the patient, this dilatation can damage by foot, and the patient can have bleeding from
internal bleeding.
Da, it's very dangerous disease.
By food, by taking food, it can damage.
Da. No, for instance,
Bones, like bones, we eat non-veg.
да, ну или
In the peristalsis, man, through peristalsis it may.
Bones. Harike time.
no, no bones. The heart, a
This is
little
harder
piece
than
of the bread.
Yeah.
Да.
Yeah.
No, you can see the pictures, and patient can die. Так, next, do you understand me? The first main anastomosis of the abdominal cavity. Normal condition, no problem. Abnormal, the patient can have the very dangerous disease pathology condition. Так, да, так. Next, just 1 second. Anterior anastomosis. This anastomosis is located on the anterior abdominal wall around umbilicus. Students. Around umbilical, we have the paraumbilical parietal plexus. This plexus is venous, and 3 veins start from this plexus. Superiorly, the superior epigastric vein starts from there. Inferiorly, inferior epigastric, and paraumbilical. Paraumbilical veins are tributaries of the portal vein. That's very thin. Superior epigastric passes through diaphragm and becomes internal thoracic. Internal thoracic drains into brachiocephalic, to brachiocephalic, forms the superior caval vein. Inferiorly, inferior epigastric vein continues and drains into the external iliac. External iliac forms the common iliac, inferior caval. So the blood tries to pass alternative reverse pathway and passes through paraumbilical vein from portal vein to the paraumbilical plexus. Paraumbilical plexus is formed by very thin veins, and blood passes through superior epigastric and inferior epigastric, the superior and inferior caval. A lot of time veins dilate, and we can see the meadows head of the meadows. Just
Medusa.
the
Golova. Head.
varicose dilatation. Da.
Живот.
Da. This you can see this. It's varicose dilatation of the paraumbilical veins of the paraumbilical plexus. This typical. No prolapsion. This ascites during the students. This prolapsion of the anterior abdominal wall is the symptom of the ascites. Ascites, a lot of fluid inside abdominal cavity. The problem is liver. No, maybe cirrhosis. Maybe cirrhosis. This you can see varicose dilatation. This meadows, head of the meadows. The symptom of the cirrhosis, portal hypertension. Do you understand?
Yes.
Normal condition. It's okay.
Correct.
Abnormal. The doctor can see the head of the meadows. Так, next. 1 second. Inferior. Portacaval anastomosis is located closer to the inferior abdominal wall at the level of the rectum. I remind you, the venous plexus rectal is subdivided into 3 parts: internal, external, and inferior. Internal under mucous membrane, hemorrhoidal zone. External between muscular and adventitia, and inferior around the anal orifice. Students, the internal rectal venous plexus is the place of starting of the superior rectal vein, external middle rectal vein, and inferior rectal vein. These veins start from the plexus and continues into rectal superior, drains into inferior mesenteric. This is the tributaries of the portal. Rectal, middle rectal, internal iliac, internal common iliac forms the inferior cava. And inferior rectal vein drains into pudendal internal and internal iliac, common iliac. The normal condition, the blood from the rectum inflows into the superior, middle, and inferior rectal veins. Students, portal hypertension. Portal hypertension, that blood reverses pathway from inferior mesenteric, superior rectal, passes through plexuses. First one, dilatation is the dilatation of the internal. Second, after external. And last one, the inferior, the terminal study of the development of the cirrhosis. I will show the varicose dilatation of the hemorrhoidal plexuses. Internal.
Hemorrhoids.
Nodes internal, external. You can see the prolapsion, varicose dilated the nodes, veins, nodes outside. But students, hemorrhoid is the proper, no symptom, the cirrhosis. Non-specific, да. But varicose dilatation of the veins of the esophagus, varicose dilatation of the paraumbilical plexus, specific symptoms. But hemorrhoid, no. Maybe the types of the food, very specific.
Long-term constipation.
The symptoms. And last group of them, anastomosis, 3 anastomosis are located on the posterior wall of the I will explain. Posterior wall of the abdominal cavity. You can see this abdominal cavity, this thoracic cavity. Between thoracic abdominal cavity, you can see the diaphragm. I sent this picture.
No.
Yes. No, ma'am.
Oh, no, I will send that. Зимой. Diaphragm. Tributaries of the inferior caval vein, the lumbar, 4 lumbar pair veins, and connections between lumbar vein, ascending lumbar, right and left. Both veins passes through diaphragm and becomes azygous and hemiazygous. hemiazygos drains into azygos, azygos drains into the superior caval vein. So the connection between azygos or lumbar and lumbar ascending is the cava-caval anastomosis.
Yeah.
For passing all
I
the foot.
didn't get that picture. This lumbar vein is giving blood to the azygos, hemiazygos, or directly to the inferior vena cava.
Lumbar
The
drains into the inferior caval vein. Ascending starts here, and connects. Lumbar passes.
by connecting them.
Da.
Lumen connects or not, ma'am?
Da.
Lumen connects.
Da.
Blood mixing.
Blood mixing is there or not, ma'am?
It's not. It's veins.
सेपरेट कैसे
No mix, okay.
Нет, it's
Separate.
veins.
अब काटोगे तब
Veins
Ma'am,
blood.
he is asking that from the colon
No, ma'am,
the
I'm asking
the
Please.
the blood in the lumen of this lumbar vein means, ma'am, this is the lumbar vein.
Da.
It is, ma'am, here it is passing with the ascending lumbar vein.
Da.
Ma'am, this
Da,
lumen,
da,
this
da.
lumen mixes the blood or not? It mixes.
No, da. Da from lumbar, from ascending, together.
Ah, okay, ma'am.
दोनों एक साथ मिलके जा रहा है वो
No, not division
Yeah,
of the
yeah.
lumen. Da.
दिमाग में
The
एक movement
blood
करता
can pass through lumbar and no, for instance, students, the metastasis into the retroperitoneal lymphatic nodes. This node is located here and presses this place, and blood can pass through lumbar. This
Yeah.
because the lymphatic nodes presses, but venous blood passes through lumbar and through ascending.
आ जाएगा
It's connections between veins.
Okay.
Да, it's anastomosis.
Sure.
Anastomosis.
समझा तेरे को
हाँ. पहले आया था दिमाग में.
First cava-caval anastomosis. Second cava-caval anastomosis is located along the vertebral column and is represented by venous vertebral plexus. Students, you should remember, around vertebra we have two plexuses, external and internal. Each plexus is divided anterior and posterior. Take blood from the spinal cord, meninges, vertebral column, and cervical, thoracic, lumbar, sacral parts. But very long plexus. Upper half, blood from the upper half. Should go to the upper veins from lumbar and sacral to the lower veins. So veins which take blood from the plexus are called the intervertebral. At the level of the neck and thoracic cavity, intervertebral veins drain into the vertebral and posterior intercostal vein. Vertebral, vertebral veins drain into the brachiocephalic is tributaries of the superior caval. Posterior intercostal veins drain into the azygos, hemiazygos, and hemiazygos accessoria. They are tributaries of the superior caval vein. So the blood from the upper half
directly is
go
going
to
into
the superior
vein.
caval vein. From the lower half of
goes
the
into inferior
plexus,
canal.
intervertebral veins drain into the lumbar and sacral inside pelvic cavity. Sacral are the tributaries of the internal iliac, common iliac, inferior. Lumbar are the tributaries of the inferior caval vein. So, students, plexus venosus vertebralis, plexus, is the second cava-caval anastomosis. First anastomosis between lumbar and ascending. The second venous plexus.
Venous plexus vertebralis.
And last anastomosis, students. Posterior porta-caval. Porta-caval. Posterior on the back side, students, behind ascending, descending colon. Now, between colon and muscles, we have fat tissue. Veins which take blood from this fat tissue are called mesoperitoneal. We have two types of the mesoperitoneal. This space is called the mesoperitoneal space, and veins which take blood from the fat tissue are called the mesoperitoneal. These veins are subdivided into two types. First type drain into lumbar vein, and because the fat tissue is the structure like parietal, maybe visceral, and one half of the veins drain into lumbar parietal tributaries into the inferior column vein. The second half of the mesoperitoneal can drain colic, right and left colic, together with veins which take blood from the wall of the ascending descending column. And right and left colic drain into inferior superior mesenteric, superior mesenteric, inferior mesenteric, drain into the portal. So it will level all the fat tissue behind ascending descending column between walls, vertical section. These muscles, this ascending column, descending column, this sagittal section. Students, this fat tissue. This lumbar vein. The lumbar vein is afflicted horizontally. And you can see the mesocolic, and second half. Mesocolic drains into the right and left colic. And so we have the anastomosis behind ascending descending colon between colon and wall of the abdominal cavity, fat tissue, behind fat tissue, portocaval anastomosis. Do you understand?
Yes.
Okay. That's all. Information, no, blood circulation of the fetus, right.